Hello, I'm Dr. David Degatti. Thank you for joining us for today's episode of Catholic Health Stronger Together with Dr. Dave. Today, we are going to discuss how Catholic Health delivers the right care at the right place and at the right time. No matter where you are, Catholic Health offers easy access to the care you need. When people think of Catholic Health, they may think of our various hospitals, cancer institutes, and nursing homes located across Long Island. But that is only the tip of the iceberg. Catholic Health is an integrated health care system with an extensive physician network that encompasses primary care as well as ambulatory care and telehealth services outside of the hospital setting. Today's healthcare consumers are interested in healthcare programs that preempt the need for hospitalization, addressing disease before it surfaces, or treating it effectively before advanced care may be necessary. As Catholic Health's president and CEO, Dr. Patrick O'Shaughnessy says, we are focused on transforming sick care to health care and offering the resources to ensure Long Islanders live healthier lives. How do you, as an individual, help move from accessing care only when you're sick to actively engaging in your health to prevent or detect issues earlier? You start by partnering with a primary care provider or PCP to steward you through your personal health journey. Think of your PCP as your first contact for general health questions, annual checkups, vaccinations, and immediate treatment of health issues. Your PCP is your long-term healthcare partner who knows your medical history and can coordinate with specialized care providers or advanced screenings should the need arise. In essence, your PCP is your medical home base, and Catholic Health makes it very easy to access primary care with more than 2,000 affiliated practices and physicians situated throughout Long Island. Here to help better understand is Catholic Health's Vice President of Primary Care Services, Dr. Anthony Ardito. What we want to speak about today is primary care, and I've been practicing for about 15 years on Long Island, and I think you've been practicing a little bit longer than that. How has primary care changed over the last 10 to 15 years?
Well, thanks for calling out my age, but primary care is extremely important to patients because if you think about it, every patient is unique. They bring a unique aspect to the care, and they have their own fears, they have their own concerns. Primary care doctor will address those concerns with the patient and really focus on how to get to the best outcome those patients need. And if you look at patients that don't have a primary care physician, they often receive fragmented care. They're seeing cardiologists, they're seeing endocrinologists, there's no one to really sort of manage that. That primary care physician can help manage the care of that patient, looking at the patient's goals in healthcare and trying to organize that care in a way that best suits the patient.
So that primary care physician is that person who can organize, make sure that things aren't missed, integrate it, and then finally explain it to the patient in terms that they can understand. What I see in my own practice is a lot of patients will come to see me and they actually don't have a primary care physician. And I think what's going on in the world, and I think you probably agree, is that urgent care centers are so prevalent, and they're really important. They definitely, I do think that they have an important role to play, but people are relying on the urgent care center model as their primary care physician.
I mean, the urgent care model was really designed around to try to prevent the high cost expense of an ER visit, To me, urgent care has changed the way primary care practice is run. We no longer get those simple sore throats or those earaches or those sinus infections. They're walking into an urgent care center. What we see in primary care practice is the sicker patients, those that aren't getting better after they've seen another provider, the ones that have more complicated illnesses that can't be served in an urgent care center. So it's actually made our practice population of patients sicker, because we're managing those population of patients that are going to the younger population that are using the urgent care center for their care. Eventually, they get that fragmented care. They may see a doctor once and maybe another doctor another time, but they really need to start looking at what their long-term goals in healthcare should be and having physicians designed to help manage that care that they're going to need in the future.
Getting to know your patients is half the battle. If you have a patient that never complains, suddenly complaining, you really need to take that seriously. I mean, you take everything seriously, but that's a red flag. I don't know that's appreciated in the urgent care setting. You don't get to know patients at a level where this person needs to go to the emergency room and this person's been complaining about that for a decade.
Absolutely. I mean, a primary care doctor who's been taking care of a patient and their family for 20, 30 years knows how that patient behaves and acts. And when they do call you up at 10 o'clock at night saying, I don't feel well, first question I ask them is, Mrs. Jones, you haven't called me up in 10 years. What's really bothering you tonight? And it really is, knowing that patient really determines how we manage that patient and their care.
For the people watching right now, how do you pick a primary care doctor?
There's a lot of ways. Most of my patients come through patient referrals. Patients' experience in our offices drive that additional, recommendation to the office. If you look at what patients are doing now, social media, 65% of patients will look in social media to determine, do I really want to go see that doctor? What are other patients saying about that practice? So before they even make the appointment, they're researching us online. So to me, patient experience is extremely important to us as primary care physicians. That experience starts when they make that first phone call. Do they have the access to the primary care physician? Do they have when they walk into the office, are they looked at and have eye contact? Is the staff pleasant when they reach in? And when they get into the doctor's office, are their questions being answered? Are they being addressed? And so when they finally walk out, is it a good experience for them? That's really what drives additional volume to the practice. So to me, patient experience is so important to our overall health system goals.
It's that extra care, that extra compassion. And I really think that is the theme in Catholic health that I'm seeing over and over and over again.
I was going to say the same thing. Taking care of high blood pressure is easy. Treating somebody for diabetes is easy, but listening to the patient, understanding their true concerns, looking at the body language to say, are they really telling me what I'm looking for? That's much harder. So that's a talent that doctors develop over years to be able to really pull out from the patients what's driving that visit and what can we do to help. Giving somebody a blood pressure pill is probably the easiest things we do, but really getting to know the patient and their medical concerns and developing a plan that suits their needs is really what primary care is about, and it's the hardest part of what we do.
Primary care is more important now than ever because patients have access to a lot of information, but they don't have the expertise most of the time to filter what they need to know, what's true, what's not true. If you don't have that doctor who you trust to ask these questions, you're in the dark. So I'm so reassured today that primary care really, I think it's having a resurgence. I think there was a question when the urgent care centers were coming out, but I really think we have learned from urgent care how important primary care really is.
I'm glad you said that, because primary care to me is really becoming extremely important, particularly with technology and the amount of specialists that are available. Even if you look at orthopedic, there's a hand surgeon, there's a back surgeon,
right.
There's a neck surgeon. There's so many specialists out there that a patient cannot manage the landscape and the coordination associated with that without having somebody to go to ask these questions of. It's becoming more important to have a primary care physician in the current market because of the advances in technology. And somebody who's seeing a cardiologist, a pulmonologist, an oncologist, or whatever they're seeing needs to have that one person to say, are they doing the right thing for me? And is this the right method that I should be treated? In the old days, primary care doctors' office often looked at as somebody that just hands out referrals. Go see a knee pain. So a good internist will actually look at somebody with knee pain and make that evaluation. Do I need to send them to an orthopedic doctor? Or back pain, do I really need to send them to an orthopedic doctor, or can I get away with physical therapy and treating this person conservatively? You know, a primary care physician should really look at a patient and manage the condition until they feel they need the help.
Right, absolutely. And of course, with compassion, treating patients, again, like we would want to be treated, like our families would want to be treated.
Absolutely.
So, how are primary care providers important to a health system like Catholic Health?
Well, they manage patients and they control patient volume. So a primary care physician with a large patient panel is extremely important to a health system, not only because they can direct where patient care goes, they're involved in quality. So to me, a health system these days are being ranked in terms of quality. Catholic Health is notoriously known as the best quality health system on Long Island. And that's because the primary care doctors are driving that number. So when you look at what we're trying to get accomplished, you want to be affiliated with primary care physicians that can provide high quality care in a cost-effective way that manages in patients and that have great patient experience. And that's really what we're trying to focus on. So when we go out and meet with our primary care physicians, these are the things we're sort of working on. What we can do better in patient experience, what we can improve on our quality scores, and how we can do that better for the patients and improve access. So it goes back to, I think Dr. O'Shaughnessy's saying is the right care at the right time with the right people, and really providing that care when it's needed.
It's incredible how much emphasis is being placed on, making sure that we are paying attention to each individual patient. So it's very reassuring. We need to take a break. When we come back, we will continue our conversation about accessing Catholic Health many healthcare services.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
Welcome back to Catholic Health Stronger Together with Dr. Dave. We continue our conversation with Dr. Anthony Ardito about how to access Catholic Health wherever you are and whenever you need. All right, Dr. Ardito, on to the next issue. Doctors are inundated with patients, and my concern always is that we keep seeing more patients just because the patient population is aging and they're living longer. But we also need to be very careful to maintain value, to maintain quality, to make sure that we're not just a numbers game, that every single patient throughout Catholic Health is getting the best high-value care they can get. So tell me what's going on with healthcare in terms of value-based medicine.
If you look at the cost of healthcare these days, it's not sustainable. Healthcare costs keep increasing. And insurance carriers are trying to struggle with that, and they really have two choices. They either can cut costs across the system and reduce reimbursement to providers and healthcare, which is only going to drive them to want to see more patients and more volume and eventually hurt quality.
So it makes the problem worse.
It will make the problem worse. Or you start rewarding physicians and healthcare systems for high quality. So you start taking money away from those lower performing physicians and health system and start bringing those patients and resources to those health systems that do well. One of the things we do well here in Catholic Health is we are one of the highest quality health systems on Long Island, and our goal in primary care is when you see a Catholic Health logo on an office or a provider's practice, you're going to know you're going to be getting the best quality care. So you can take a deep breath, know that the doctors there are going to be striving for great patient experience and provide you the service on an individual basis that you feel that you're truly taken care of. And our model is going to really to support physicians that provide that high quality care.
I think it's really important that, like you said correctly, you see the Catholic Health symbol, you can almost guarantee that, well, I can tell you what you can guarantee. You can guarantee you're going to get a compassionate healthcare provider. So I would go as far as saying if you see a Catholic Health symbol, not only are you going to get great medical care, you're going to have compassion and an empathetic healthcare provider. I think it's so reassuring.
And that empathy and that compassion starts with that first phone call, how they're answered, how they're treated when they when they seek medical care. Often they're scared. Patients are concerned. They're nervous about coming in. They don't know what's going to be found. So, sometimes they get frustrated in healthcare. So our goal is to really make that access to our healthcare providers as easy as possible and make that interaction with them as comfortable as possible, so they feel that they can speak to their doctors. And that's really what we're trying to accomplish here.
Every guest we have on this show has said the same thing. So this is a theme, and it's a real priority, and it should be a priority. So that's very reassuring. So anybody watching this show, look for the Catholic Health symbol, right?
And you will know you will get high quality care.
Right, that's right. So
compassionate,
high quality care. Let's transition. So we made it through, for the most part, COVID. We learned a lot. But one thing that came out of COVID that I think we're all a little surprised about, but we knew it existed and we never wondered why, we never understood why it never took hold, was telehealth, right? Makes sense in theory, right? It seems easy. What was your experience during COVID with telehealth?
With the onset of COVID, we realized that a lot of these patients weren't coming in. They were afraid to come into the medical facilities because of fear of exposure. We needed to come up with a solution for that, and telemedicine was an easy fit for us. We spent the first 2 to 3 months of COVID going out and training every primary care physician what telemedicine is, setting them up for that program, and educating our patients that they have the ability to access one of our primary care physicians to receive the care that they need. And I think it was a game changer in terms of us managing our patients. As COVID has sort of decreased in number, we realized that telemedicine visits is here to stay. We're going to be using telemedicine for enhanced access. So one of the programs that we have right now is a virtual primary care office, so that if a patient calls one of our primary care practices, the provider is busy or can't get an immediate appointment, they're going to be offered a visit in one of our virtual care primary care settings and being taken care of by one of our doctors immediately to address the issues and eventually get them back to the primary care doc. After hours access, so after 5 o'clock when the provider's office is closed, we're going to offer virtual primary care for those patients who need to talk to a doctor in a face-to-face capacity, so we can direct their care and determine whether or not the patient needs to go to an urgent care. If you think about what's going on in urgent care and ERs, they're overcrowded. You have to wait there for hours. We can probably decompress a lot of that by allowing patients to talk to one of our providers and saying, you know what, we'll get you an appointment tomorrow morning with one of our primary care doctors so you don't have to go sit in a crowded emergency room.
Now, when you say telehealth, are we talking about video interaction?
Video interactions with the patient, so face-to-face. And some of the technology that we have right now, we're putting consoles in certain locations around Catholic Health that actually lets patients sit in front of a screen that has a blood pressure cuff and even a stethoscope, that the doctor can hear it as if they were placing the stethoscope on the patient. So the technology, I think, is leaning towards patient access from their point of care to our point of care and allowing us to take care of them without actually being in the same room.
That's amazing, and I think it's a no-brainer. It seems that it has to go in that direction, especially as people age and it's harder for them to get out.
But I think it's a technology that is more adapted by the younger population because they want that immediate satisfaction. They want to be able to talk to a doctor. Even if you give an appointment at 4 o'clock in the afternoon to come in, they have to drive by 5 urgent care centers to get to you.
Right.
Most likely they're going to stop in and cancel your appointment that day.
That's an excellent point.
Our use of virtual care is to leapfrog the urgent care setting and give them that immediate access when they want it.
Right. I mean, we thought access going to the urgent care was a new, forget it. You don't even have to leave your house.
This is going to leapfrog that.
It's unbelievable. And I think it's great. I think it's great for patients because it does cut down on anxiety. It cuts down on going to the emergency room unnecessarily.
And we can direct care where care is needed.
Right. Absolutely. I think overall it'll be cost effective too.
Absolutely.
Yeah. So that's so exciting. And Catholic Health is on the cutting edge of all that and embracing it, which is even more exciting.
Yeah.
So
we've actually started our own virtual care unit and hiring physicians to support that.
That's amazing. That's great. As we progress to population health, how do you see primary care providers playing a role?
Well, population health to me is managing common diseases in large populations of patients. And Catholic Health, we see the value in that, but we also see in the value of treating every patient individually. So we're going to take those ideas on how to best manage patient care and bring them to a patient level. So to me, managing patients in a population health is heading back towards value-based care, is really providing the highest quality care for that patient when the patient needs it. So to me, access drives that, and patient experience drives that, and the quality of the physician that is managing those patients drives that. So even though population health is looking at how best to manage large populations, we're bringing it down to the patient level.
And again, it's the theme. It's getting to know each individual patient, being compassionate, treating them like they're your family, really.
We are a very large system. We have the resources and the tools we need to be successful, but we're not big enough that we forget who we're taking care of. And to quote again Dr. O'Shaughnessy, we are not going to be the biggest, but we will be the best healthcare system on Long Island.
Yeah, I love it, and I think it's I think it's true. I think it's important, and it's just going to keep getting better.
We really continue to strive to provide that high quality service, and every patient that comes into our system, we look to treat them and their goals. And it's more of a partnership, and it's not just us telling how patients should be managed. We partner with our patients to provide the care that they feel they need.
That's excellent. I really want to thank you for taking the time out of your schedule, because this is a really important message for people who are confused right now. Do they need a primary care doctor or not? The answer, I think, unequivocally, at least in my opinion, I think in yours too, is yes, 100%.
Absolutely, and thanks for the opportunity.
Thank you, Dr. Ardito. We have to take a short break, but when we come back, we'll hear from a patient who was out of state when she experienced chest pains. Luckily, she didn't ignore the signs and turned to Catholic Health.
Discover immunotherapy and find out how your body's natural immune system can become your greatest hope in the fight against cancer. Speak with your doctor and visit su2c.org/immunotherapy to learn more.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Phyllis Abrams of Glen Cove has been a longtime patient of Catholic Health's Vice President of Primary Care, Dr. Anthony Ardito, who is a practicing physician in New Hyde Park, an active woman in her 70s. A couple of years ago, she was visiting with family in California when she began experiencing chest pains during moments of physical exertion like walking. She decided to see a cardiologist in California who examined her, administered a stress test, and told her she was fine. When she returned to her Long Island home, she consulted Dr. Ardito, who felt more tests were necessary. He referred Phyllis to Chairman of Cardiology for Catholic Health St. Francis Hospital and Heart Center, Dr. Richard Schlafmitz. He administered an angiogram which showed that Mrs. Abrams was indeed suffering from an arterial blockage. An angioplasty was quickly performed, rectifying her heart condition. We spoke with Mrs. Abrams. Take a look.
I went to visit my newborn grandchild, and while I was walking fast, I started getting chest pains. And I knew something was not right, but they went away, and they didn't occur when I was sitting. They only occurred on exertion. So while I knew that something was wrong, I didn't want to go to any other hospital. I didn't want to go to an ER in LA. And I called Dr. Ardito from LA and made an appointment to see him as soon after we landed here. And when I went to see him the day after we returned and told him what happened, he was concerned, to put it mildly. And he told me that I had to go to the emergency room, and he called Dr. Schlafmitz. The next morning, we went to the ER, and by the end of the day, I had a stent. And I have felt fine ever since. Dr. Schlafmitz mentioned after the procedure that I had had a 99% occlusion, and that if it hadn't been stented, I would have possibly died. Dr. Schlafmitz made me feel confident and safe. It was very clear to me that he knew what he was doing and he would take care of me. I came from California to St. Francis because I have so much confidence in the hospital and the nursing care and the doctors. I feel that Dr. Ardito is one of the most caring and knowledgeable doctors I have ever had, and he too makes me feel confident and safe. I'm feeling wonderful.
She's now doing fine and is very active in her Jewish center. At Catholic Health, we ensure that patients can recover effectively in the comfort of their homes while maintaining the very highest high level of clinical care. Should a visiting nurse be required, they will monitor the patient's condition on a regular basis and also educate the patient and key family members on the protocols that ensure a sound recovery. There are circumstances when a health issue will necessitate hospital care. Catholic Health strives to make your hospital stay as short as possible, especially when your doctors deem you are able to continue your convalescence at home. Let's take surgery as one example of the need for hospitalization. After a few days, you may be very able to return home to continue your recovery. At that point, your primary care provider becomes your medical quarterback, staying in touch every day and coordinating your continued care with all necessary nurses or specialists. In those situations, Catholic Health physician partners will coordinate with Catholic Home Care to develop a recovery program designed specifically for your needs. Our post-discharge program may entail a visiting nurse as well as a telehealth and telemonitoring services to steward your at-home convalescence as easily and effectively as possible. Catholic Health's website, chsli.org, features our Find a Doctor tool, which allows you to filter by location or hospital affiliation. Just choose a Catholic Health primary care physician that, at a convenient location, make an appointment for your first consultation. For more health information, tune into Catholic Health Stronger Together with Dr. Dave. If you would like to know more about how Catholic Health makes healthcare accessible across Long Island, or to make a gift in support of this or another program that is important to you, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. David Degatti, and I hope to see you next time on Catholic Health Stronger Together with Dr. Dave.